Tennessee This Week from WATE 6 on your side starts now.
Hey everyone, and welcome to Tennessee This Week. I'm Blake Stevens. Well, the reopenings are underway, but it's going to be a process. Wednesday, I caught up via Zoom with the CEO of the Knoxville Chamber and the Knox County Health Department Director to talk about our community's plan. So you two have been working together a lot as far as getting this reopening plan unveiled and implemented. I just want to ask you both what that process has been like. We'll start with Mike, since he called into Zoom first.
A lot of meetings. As I've told people, my life right now, one perpetual Zoom meeting. So it was a lot of discussions, both within the group, the task force itself, and then reaching out to specific businesses and business people and stakeholders to kind of bounce ideas off of and try to get to a place that both the business community and the health community could feel comfortable with.
Yeah, and Dr. Buchanan, what about you?
I'd agree. It's been a lot of meetings and a lot of discussions and a lot of attention to detail, really wanting to get the best information out there that's going to protect the health side, but also support the businesses.
And Mike, I just want to pose this question to you specifically. How hard has the business community been hit? I know sort of it's obvious you guys have been hit, but can you maybe put it in terms we'll understand?
Yeah, so we did an economic impact survey the last 3 weeks or so, and just starting to get that information out there. But you know, non-scientifically, it was about 62% of the business community here in the region have seen a significant impact of the pandemic in terms of economics. You know, so we've seen many of them close their businesses temporarily or adjust the hours or have to lay off staff. At the same time, we did see, you know, 2 or 3% that actually saw business increase and have seen a larger demand for their product or services. And so that's been reassuring. And I think one of the telling data points that we saw was the fact that only about 35 to 40% of the business, or I'm sorry, I should say about 35 to 40% of the businesses said that they believe this is going to be little to moderate over long-term impact for them.
Okay, we'll keep our eye on that. So my next question to you both is about impact. Dr. Buchanan, my question to you is phase 1 of reopening. I'm curious to know how that will impact coronavirus cases in our area, and to Mr. Odom, how will that impact the business sector? So Dr. Buchanan, we'll start with you on that question.
Okay, thanks. So the short answer is we expect cases to go up. With the plan, though, what we hope is those cases will not go up exponentially. They'll just go up a little and kind of stay manageable for our healthcare system. The goal in a phased reopening is really to continue what we've been doing, which is keeping our case counts lower and keeping our new cases at a minimum, at a rate that the healthcare system can tolerate. So that's what our hope is. We do expect an increase, but we hope that increase will not be a big spike and that our healthcare system could tolerate it.
So Mike, how do you see this impacting business being able to reopen?
Well, you know, business, it's funny, we were saying yesterday when our Monday rather than plan came out, the feedback has been about half of the businesses that can open hate it and half of it can't open hate it. So it's probably meant we probably had a good balance in terms of what we were trying to accomplish. I think, you know, this is going to be difficult for everyone, and whether it would have been staying closed or the phased reopening, businesses, even those who can reopen, have to go through certain metrics and certain things that the guidelines that they have to do. So I think there's, you know, there is no quote new normal. It's just we're going to have to work to try to get there as best we can.
And how practical is it from a health standpoint and a business standpoint to count heads, make sure that you're not exceeding 50% capacity. Dr. Buchanan, do you see it as a manageable task for most businesses in Knox County?
Not being a business owner, that's really a challenge for me to answer. I know that anecdotally we've heard from some businesses, they've already got a plan, they've figured this out. They know their business much better than either Mike or I do, and know how they can do that. And, our businesses want to be safe. They want to be open, and they want to keep their employees and their customers safe. And I think they're going to take those steps. For some businesses, it's going to be a heavier lift than for others. We acknowledge that. And we're hopeful that we can continue as a community. How do we provide resources for those businesses? We're asking some businesses to require masks. So how can we provide a resource for those businesses so that they bear less of that burden? I don't have that answer, but I think as a community, we should start thinking about that.
And Mike, do you see these guidelines as practical for the majority of businesses in the county?
Well, I think the head count piece of this, which is when you have a capacity, that's pretty easy to be able to measure. So people walk in, you keep accounts, people walk out, you subtract that count. That's not the piece that we've really heard feedback on. It's really been the increase of station requirements. And that was not necessarily just respective of the guidelines and the reopening plan. That's going to be the case going forward. And so for some businesses to add, shielding in front of cash registers and requiring, as Dr. Buchanan said, there are teams to wear masks if masks aren't available, or to take temperatures and things of that nature. I think that's going to be the bigger hurdles that businesses are going to have to work through versus just, hey, I'm at 50% capacity. How do I know that?
If this is successful and we're able to advance on to the next phase in the future, phase 2 and then phase 3, what can you tell us about who is a part of those phases, and what's that process going to look like over the next few weeks?
So I know from our perspective, the creation of the listserv for employers to have somebody become their COVID-19 coordinator and get information pushed out to them, but that's also going to be a method by which we get information back from businesses. We hope to use experience from phase 1 to help inform phase 2 and how to roll that out differently, hopefully a little more smoothly and with more planning, because we've got time to do that, and we're going to start collecting that information. And so hopefully we'll be able to do that. I think we'll have to step it out carefully, like we've done this, and we'll learn a lot from this. And a lot will be based on, obviously, decisions will be based on case counts, but not just case counts, hospital capacity, and other things, quite frankly, the health department's capacity. Can we build it out to meet the need there as well? And I think we can, but I think we intend to use the feedback we get from businesses to inform what we do next.
And Dr. Buchanan has pointed out, with the health briefings, that it's really our behavior and our adherence to these guidelines that determine our outcome here. Mike, it's those businesses that are in phase 2 and phase 3 are really counting on that spread to stay as contained as possible.
Yes, and I think in our discussion with the task force was not to try to get too far ahead of ourselves with phases 2 and 3. Was to let's take our time. Let's see what happens. To Dr. Buchanan's point, let's get the feedback from the business community, from the consumer community, see how they're reacting to this, the employees of the businesses, and then really be able to look at that data and say, okay, this is what we feel comfortable with 2, and this is what we feel comfortable with phase 3. The guidelines say that we will not move on from phase 1 to phase 2 for 28 days. So that gives us that 4-week period to really dig into the information and make good decisions.
Well, the last thing I want to ask you both is about pressure. I can only imagine how much pressure you must both be feeling from the public. We've seen protests, and there are more protests planned. people wanting to see businesses reopen. So just in your both respective professions, talk to me about that pressure that you may feel and what your message to the public is going forward. Dr. Buchanan?
Sure. So yes, there's a tremendous pressure from the public, from the business sector, from politicians, from lots of folks who want to get things back to normal. But my job as the health officer in Knox County is to take all that input and consider the health implications of making a change. You know, we close things down periodically, not on this scale, but we have to consider all of those things and weigh all of those things against the potential negative health impacts and make those decisions with data and information. And, you know, considering what people want to do also, we can't ignore that, but it can't be the only thing that drives our decision making. We have to use good judgment and use the data that we have and the evidence that we have to inform those decisions.
Mike, have you felt the pressure, and what would your message be to the public?
Oh, I feel no pressure. I just have them call the health department. I tell them to call Dr. Buchanan. No, it really, there hasn't been as much pressure as especially post guidelines being out there, explain how you guys got to this point. And as I've kind of explained to people, we started with a physician, a not health department necessarily, but health professionals that says, look, we should just keep everything closed as long as we possibly can. That was not the discussion, but that's the mentality. And so we had to slowly work our way to get, okay, if we do this, how does this work? Now, as we were doing this business, and this is where I give Dr. Buchanan and her team and Krista Baig, who worked with the task force a lot from the county, was we were still learning what this pandemic was doing. And so almost every day when we were getting together, or we meet twice a day, whatever the case would be, we would have learned something new. So, okay, well, if it's doing that, then we have to change the way we do this. And that was really where the pressure that personally I felt was, we're trying to do this as the understanding of this health scare really is changing almost daily. Mm-hmm. And so no, I really didn't get any pressure from those other people. It was really just trying to just explain how we got to where we got to.
Hello, I'm Mike Hatmaker, Jim COGDILL, Crossing Jeep Ram. During these unique times, let me show you how we're trying to create the safest environment for you. Commercial deep clean, pressure clean all ductwork, improve air quality, sanitize all surfaces, floors, tabletops, steam clean carpet, tile, and upholstery. All restrooms sanitized. At-home demo and delivery. Online pre-approval. 90 days till the first payment. 0% for up to 84 months. Ongoing parts and service for all your needs. COGDILL trade-in allowance plus. Whether we come to you or you come to us, one thing's for certain, we're here for you. Jim COGDILL's Chrysler Jeep Ram.
For all those going out each day, doing what they can to hold us all together, we're here to help those helping us all by keeping our lights on.
Many of us are feeling anxious, worried, and sad.
We're all dealing with uncertainty, but I believe in the people on the front lines.
The scientists, the doctors, the nurses,
they are truly on our side.
So here's to the people battling the virus every single day.
Trust them to help us all get through this.
Believe in them.
And thanks for trusting us
to keep you informed
with the facts.
WATE 6 is on your side.
Welcome back to Tennessee This Week. Governor Bill Lee traveling to our nation's capital, speaking alongside President Trump about COVID-19 testing efforts. The trip to D.C. was one day after announcing widespread COVID-19 testing will soon begin for residents and staff at all long-term care facilities in the state.
You know, there's a scripture describes being hard-pressed on every side, but not crushed. And that's where we are in Tennessee. I think that's where we are in a nation. But the elderly are most hard-pressed in this setting, and especially those in long-term care facilities, and they need our help. So in Tennessee, we're committed to testing every resident and every staff in every one of our 700 long-term care facilities.
Well, this comes after deadly outbreaks at Tennessee nursing homes, including one in our area. As of Thursday, 2 people have died at the Life Care Center in Athens. Dozens more testing positive for COVID-19. Now, President Trump said his administration is, quote, doing everything possible to support the state-led management of nursing homes. Well, still to come, our panel of pundits. You're watching Tennessee This Week from WATE 6 on your side.
Do you work out of your van or truck and need the biggest choice of racks, shelving, or sliding cargo trays? Let Phoenix Conversions help you, as they have expanded their commercial division and now have a 10,000 square foot showroom full of products for you to select from. If you're a contractor or fleet owner with 1 truck or 100 trucks, Phoenix can set you up to maximize efficiency with everything organized and safely stowed away. Come see for yourself today at 5915 Casey Drive. Need directions? Check us out at phoenixconversions.com.
Phoenix Conversions, when it has to be the best.
A typical auto insurance policy could be yours. Want to know what's in it? Pages and pages of exclusions. You get injured in a car wreck. The insurance company isn't going to tell you everything they should pay you. They want to save money. We're Fox and Farmer. From the bold print to the fine print, we know everything they must pay. Do you want to know what the insurance company is not telling you about? Talk to us first and find out how much more money you can get from these policies than you might think.
Hello, I'm my cat maker, Jim Caldwell's across the Jeep Ram. Ready to get out? Come in and check out our inventory from the comfort of your own car. 2016 Ram 2500 Crew Cab 4x4 Laramie Longhorn, $49,888. 2016 Chevy Camaro SS under 29,000 miles. Sale price $26,888. 2018 Infiniti Q60 leather sunroof, all the equipment. Sale price $28,888. We're here for you at Jim Caldwell's Chrysler Jeep Ram.
All right, so we've got our healthcare expert, Craig Griffith, our political analyst, George Corda, and our political contributor, Courtney Piper. Well, guys, we just heard from the Knox County Health Department Director and the CEO of the Knoxville Chamber, and we're reopened. By the time this airs, we'll be partially reopened. What do you all make of the Phase 1 plan, and do you think it hits that right balance between safety and economic recovery? George, we'll start with you on this one.
I think nobody knows. I think they're making their best assumptions with the evidence they have at hand. And I'll go back to what I said last week. I don't think what government says is going to have the final it's not going to be the final determinant in what people do. If you don't think a business is someplace you can go safely, you're not going to go. So businesses are going to be promoting, here's what we're doing to protect you when you're here. And the ones that do the best job of communicating that message are going to be the ones that are patronized the most early on. But nobody's going to start flooding restaurants and stores and everything else right away because there's too much concern and there's too much anxiety. And it wouldn't be wise. So I think what we're going to see is people generally coming back slowly. If it spikes again, there will be some kind of response, but I don't think we can go to a wholesale national shutdown like this again.
Courtney, do you think it hits the right balance, and do you have any predictions for how it turns out?
Well, look, to a certain extent, I agree with George. It seems like how these guidelines were put out, the businesses that best communicate their policies and procedures for protecting their visitors are going to be the ones that come out ahead. What I really like about this plan is that, first of all, it was put out by the Knox County Health Department. So it didn't come from a mayor's office. It came from a group of public health experts. And also, something I've been talking about for a while is it included metrics. On page 8 of the plan, it very clearly spelled out, here's how we know that we'll be able to move to the next phase. Here's how we know if we need to pause. Here's how we need to know if we need to take a step back and go back to a safer at home type of order. And it was based on things like not seeing new cases or a pause in new cases or a decline in new cases, and making sure every step along the way that we have the infrastructure in place to care for people should they get sick. So those parts gave me a lot of confidence in this plan. And, it appears to be the best that we can do at this point. I was a little surprised that as part of phase one, the very close contact businesses were allowed to open. So things like massage parlors, or massage studios, hair and nail.
Easy there, Courtney, easy.
I won't get carried away.
That's effective communication.
But those businesses where you literally have to be in somebody's face to get the service, I was a little surprised that those were part of the phase one rollout.
Hey, Craig, what do you think of the phase one plan, and what do you think maybe happens in terms of cases of the virus?
Well, I think if you read the plan, they have one of the best analogies on it. They say it's like an accident on Interstate 40. You're going to trickle out, and then long before you go back to full speed on the interstate. So I think that we are going to, probably most people will take this fairly slowly going ahead. Will there be more cases? I believe there will be. But if we do follow the metrics that are in the plan, I think that you can find out that there's a way that you can move. And the metrics in the Knox County plan are 28 days. They're not 14 days. So in essence, you're going to have the entire month of May to take care and see what's going on. And some of the, the smaller businesses like the hairdressers and the massage institutes, they're some of the people that are the most affected by this and that are probably getting absolutely none of the paycheck protection money. So it's almost imperative that those people get relief first because they're probably suffering the most.
And my next question is about the governor's announcement this week that he would support testing for all patients and all staff at all Tennessee nursing homes after we've seen a couple outbreaks. I'm curious to hear from you guys. Should this be something we did sooner? Is it something we should have done sooner?
Absolutely. I mean, the elderly are the people that have the target on their back. So that actually should have been probably the first place that you would start in terms of mandatory testing. People are susceptible to these diseases in those close environments. So it should have been a priority from day one.
George?
Well, it goes back to the number of times we've seen stories and news reports that say there's 73 people in a nursing home and 55 of them test positive for coronavirus. So that sort of screams out, hey, if you're looking for a place to test, this would be it. So yeah, I think it's a good idea. Should it have happened earlier? Probably. But again, everybody is trying to figure this out as they go along. This is an unprecedented situation.
Courtney, your thoughts?
Removing barriers to care should be an essential function of government. So whether it's a nursing home or a prison, or really anybody else for that matter in the state of Tennessee, knowing that they can have access to a test and that they will have access to health care should they get sick should be common sense.
All right, I want to move on now to a national conversation making headlines. The former Vice President Joe Biden, the presumptive Democratic nominee for president, is facing allegations of sexual assault by a former staffer, that allegation stemming from the early 1990s. So my question to you, you all, what does this do to his campaign? Courtney?
Well, I think that remains to be seen. We're taping this before he has a chance to address the issue. This airs on Sunday. We're taping on Thursday, and he's addressing it on Friday. So I think depending on what he has to say on Friday will determine how this affects his campaign.
And before I move on, we did have a disclaimer that we're taping this Thursday night. At this point, as you just mentioned, Courtney, we have not heard from the former vice president, but his campaign has released a statement basically saying women have a right to be heard and that this claim is untrue. So we did want to get a chance to read that tonight. George, what do you make of the allegations in terms of what it does to the Biden campaign?
Well, I don't know what it does to the Biden campaign at this stage. I think it creates a problem for Democrats generally, far beyond Joe Biden, because in the wake of the Kavanaugh hearings, the Pound Me Too movement got started, and there was they were adamant, Democratic leaders were adamant that women should be believed and women had to be heard. And in fact, let me read you something here. For a woman to come forward in the glaring lights of focus nationally, you've got to start off with the presumption that at least the essence of what she's talking about is real. whether or not she forgets facts, whether or not it's been made worse or better over time. That's Joe Biden. That's a direct quote from Joe Biden. So all of these people who were adamant on the Pound Me Too movement are now in the position of saying, well, yes, women should be believed, but you can't believe her because she's making an accusation against Joe Biden. What that does for the people on the right, they've got their minds made up. People on the far left, they got their minds made up. In the middle, there are people who are listening to this and saying, now, wait a minute. A couple of years ago, I heard them saying this, and now I'm hearing them say this, and those aren't consistent. That's the problem that the Democrats are going to have.
Courtney, we've heard.
But George, what's the inconsistency here? Because I think what Democrats are talking about is when you are not involved in the situation and it didn't happen to you, that's what they're talking about, that women should be believed. And we haven't heard from Joe Biden. We don't know what he is.
And that's part of it. That's part of the problem. The websites, the political websites, the New York Times, the Washington Post, Democrats are starting to get very agitated that he's been silent on this thing. Now, this could be a vehicle to try to say, okay, let's get Biden off and try to get somebody we like better, the Democratic establishment, and get somebody better to run. But you know what's going to happen if that's tried? The Bernie Sanders supporters are going to say, here's your guy. He's the one that was second. So it's a real dilemma for Democrats.
Courtney, do you think there's a double standard in any way of how people of different parties are covered when it comes to sexual allegations?
Oh, yeah, there's a complete double standards in terms of how it's covered and how people react, too. We see Donald Trump as essentially Teflon when anybody brings up any sort of sexual harassment, misconduct claims, and even when it's right on tape in front of our faces. He seems to be Teflon when it comes to that. But, it happens to Democrats, and all of a sudden people on the other side of the aisle are demanding answers and accountability and this, that, and the other.
Oh, yeah, that didn't happen during the Kavanaugh hearings. And I just read you Biden's quote. He said,
George, I'm talking about, I was referencing Donald Trump. My example was with Donald Trump and how nobody seems to want to hold him accountable.
I think that sexual assault needs to be investigated, whether it was in the Me Too era or any other era. But I think that the results of the 2016 election showed me that these sexual exploits from years in the past don't matter as much to the electorate now as perhaps they did 20 years ago.
Greg,
the electorate wants to know what your stance on abortion, on immigration, on climate change. And if they find the person that they're satisfied with those answers, they're going to vote for that person.
That's not on sexual assault.
I have to leave it there.
Oh, you had sexual assault in 2016 as well.
I'll let you guys keep on, but that's all the time we have. Thank you, guys.
The views of guests on Tennessee This Week are their own and do not represent the views of WATE 6 on your side or Nexstar Broadcasting.